after you, Nilesh. But I start with the patient level as well, and with our little screening bus, and that's going to become a reality, I believe. The number of patients in whom disease is detected when they were previously unknown. In other words, the number of clinical events prevented. So that would be on the patient level. On a health system level, is the Echo AI turns a process that's like 30 minutes per patient, 250 clicks from a doctor for a single patient, and more than 20% variability in results between two doctors, turns all of that into just 2 minutes, a single click, and 0 variability. And so with that kind of accuracy and increased productivity, it's hoped that health systems can really sort of reduce the waiting time for a simple thing like ultrasound of the heart, and just get it out into the general and community. But last level is on the big pharma level. Now, I really think that we are wasting too much money in large clinical trials in cardiology. I mean, we have trapped ourselves in this mega trial expectation, and it's really detrimental. And part of it is we use echocardiography as a surrogate outcome to screen patients for eligibility into trials and so on. So I want to just cut the cost of all of that, accelerate drug development, and accelerate implementation of the right drugs to the right patients. And that would be on the macro level.
Well, in our case, probably serving 1 million people a month it's how we measure impact from the user perspective. Not only because the number is big, but also because 22% return to the platform within the next 3 months. So it means that we help them. And when instead of just going to an ER in Latin America, when you maybe have to commute for 2 or 3 hours, spend $2 or $3 on transportation, instead of that being able to chat with the doctor, well, that's not only, that has an economic impact also as well, and it is huge, and that's why people love the service and come back. On the other side, from the business model perspective, working already with 6 insurance companies in the region, and being able to measure that we are saving cost and improving user experience at the same time, because it's not only about the cost, but also, only 5% of people can afford private insurance, but the service is not very good. So helping there to improve the customer care metrics is also important. For us, this is just the beginning. We are trying to improve access in our region in a way that there is no barrier at all when you need to talk to a doctor, and that's what we're doing.
So something that I was thinking of as you were all giving those examples is, as you think about growth, it's really about trust. I mean, the numbers you guys, all 3 of you are just so impressive in the sorts of metrics you're aiming for or have already achieved. And yet, to expand, you've got to build relationships. And I think that's something that we all understand, and here in the US, we have to do that as well. But in a lot of these places, everything you make or break based on the relationships you have, the advocates, the stakeholders, and I often call them promoters, and because they go in front of you, right, in many cases. So you mentioned, I want to come back to that, you mentioned the UN, and you've got, I know, some really interesting promoters that help along the way. So how do you build that trust with those advocates that are on the ground even when you're not there?
Well, we look for someone that is, it's usually people. It's not an organization. Right. So what we do is we look for the right person that has the same, willing to fix the same problem. And then what we both looking is for validation. Maybe you are inside of the UN and you're trying to fix a problem, but it's a very bureaucratic organization, right? So best way or the fastest way to get something done is probably work with a startup, try something out. And for us, it's validation because it's the UN trusting our service. And then helping a lot of people also give some validation. So basically, in Latin America, when we are, I don't know how many years behind everything what is happening here, building trust with not only with the users because they're now having access and they can love it, but also with the regulators, with the whole system, it is very important. So looking for some stamps, we call it the stamps. Now we're working with this and this, so everybody now is able to trust that we're not just developers answering or providing answers, medical answers, but we're real doctors and we're real people providing good service.
What about the two of you?
I think for us, building the right ecosystem with the right trust was going back to laser sharp execution and very high integrity and honesty. Because one, being a startup in the medical field is not an easy answer to the doctors, but also establishing that ecosystem of trust within the partners and the collaborators that we have. It did boil down to how we're executing actually on the ground, right? Which means the health worker willing to trust us with the entire ecosystem that we're building. The doctor who's behind the screen, having his trust in terms of how we're executing down to the last mile. The kind of medications that we're bringing in, having that trust that they're not expired or not rebranded, especially coming from developing countries, these are the challenges and problems that we've seen. So I think it fundamentally goes back to how you're going to be executing with the partners and the collaborators that you have, how honest and transparent you are with them, because if you're not transparent, I think growing in these environments is going to be extremely challenging.
Nicole, my first reaction was very similar to Nilesh's. I was just by building the best darn product you could think of, and I say this with a lot of humility because my greatest skeptics are my own fellow cardiologists and clinical trialists. And so what we've done is we've gone straight to them. And because they're also the KOLs and the respected ones who publish and write the textbooks and so on, we've actually gone to them and partnered with their echo car labs, where also there are tons of stored images for machine learning. And we're actually going to validate our product in that, publish with them, and sort of hopefully turn our greatest skeptics into our promoters. From there, then go into the health systems. But that's sort of what we do.
So building upon that, and then also touching on what you said, we only have a few minutes left, but you mentioned regulators. And so as you say that, but so there's not only the trust building at the community level and the peer level, but we hear enough complaint. I live in DC, right, with all of our agencies cause enough problems. But you all work in spaces where, it can be pure chaos when it comes to just to put it very politely. There are ministers of, administrations of health and education that just don't exist or don't function. So how do you work with, get advocates there, and partner with those regulatory bodies, particularly as you cross country borders?
Yes. It's an uphill battle. To work with the regulators and policymakers, and especially in the healthcare sector, is very sensitive, especially in countries like India, Bangladesh, and developing nations. But I think it's going back to establishing the trust, making sure that you're executing on the ground realities are met with. Because at the end of the day, when we had discussions with the policymakers and the state governments to showcase of how we can actually help them deliver public care. And at the end of the day, that's the goal, is how do we simplify the way care is delivered in both public and private settings, create transparency and bring transparency into the system. And I think once we crossed that bridge, the doors opened up. The discussion started happening, okay, how are we going to execute, what are we going to do? We've got invitations from ministries of health across different countries to start opening up these discussions of how we can deploy this in our country, right? And that only came after we were able to showcase and prove of how we can execute this, how this is done, and showcase examples. It's not easy actually to break that barrier. It's extremely difficult. Especially because you've got the medical side, you've got the trust factor, you've got human lives at stake when you talk about practicing medical science, right?
Well, I think in our case, when it's not theory, but it's already real numbers that show an impact and people using it, there's a different way to start a conversation with the regulators. And also when we're out of Colombia, but we have operations in Mexico and some other countries in in Latin America, and then we can tell the regulators of Mexico what's happening in Colombia and bring examples how it's been used in some other places that are similar. It also helps them to widen a little bit their perspective and be more open. And again, it's about finding the right people that is able or that is willing to really take a risk, because sometimes when you're talking to regulators, it's a safe place for them. So they don't want to make so many changes because it's not nice for them. So it's just finding, again, the right people and with the right data and trust, as you said, to start a conversation and take it from there to see how can we improve, and also be able to realize that all the changes that we want won't happen at the same time. It will take time, but we need to start taking steps moving forward.
Excellent.
Well, for us, we wanted to go global from the start, and so we're actually starting with the FDA. We find that we thought that would be the toughest nut to crack, and then from there, pivot to different areas, like in Singapore, Europe, and other areas. So starting with the FDA, and then also, again, with that trust word, we've got the network. Because most of the individual countries will want to see data from their own population. And because of that, we've got a network of key opinion leaders and the top echo labs, which really, really is lovely, because that enables us to do a federated learning as well, to enhance the machine learning of our algorithms. So that's how we do it.
Excellent. Well, there's a lot of growth happening for all of you. So just to wrap up quickly, what are your 2020 goals in terms of growth?
Well, we're having 1 million users on our platform a month, 300,000 consultations. So we want to touch, by the end of 2020, 1 million consultations a month. And that's our main metric, from users using our standalone platforms and also our plugins, which are the service that we do with insurance companies. That's our main goal.
Okay.
Well, for us, we just closed our seed funding round, and so we're
Congratulations.
really gearing up to get going and about to announce major collaborations with Big Pharma, as well as a major health system in the U.S. So we're excited about that.
we
And
look
of course,
forward to hearing
FDA
that.
regulation.
So our goal for 2020 is to be cash flow positive, and also
It's a good
reach the
goal.
target of 500,000 transactions a day.
Excellent.
Very simple, clear goals that we have set for ourselves.
All right. Well, thank you all for joining us and for the conversation, and thank you all for being here. Let's give them a round of applause.
Thank you.